Welcome everyone, and thank you for joining us today for our Ask About the Vax Q&A session. This session is being recorded, so we can share a link with you after the session. We are going to remove names, but this recording could be shared with maybe some community or media partners, so we just wanted to give you a heads up on that. Today we have Dr. Shalika Katugaha, our System Medical Director of Infectious Diseases. Hi, Dr. K. Thank you so much for joining us. We are here to talk today about the COVID-19 vaccine and the flu vaccine. So I will just let Dr. K go ahead and get started, introduce yourself, and we will, of course, open up some time for Q&As as well.
All right, here we go. I'm Shalika Katugaha. I think I know many of you by now, which is wonderful. I'm just going to jump right in. So today we're talking about COVID and influenza vaccine co-administration. I'm actually going to talk about a little bit about the seasonal flu first, which is a nice break for me since I spend all my time talking about COVID. But we cannot forget the very important flu. So influenza viruses typically circulate annually in the United States, most commonly from the late fall through the early spring. Most people who get flu can actually recover, but there are some groups who get very sick when they get the flu and they get serious illness. That includes older individuals, babies and young children, people who have any immunocompromising or underlying medical illness, and that's actually the same group that gets hit with COVID. And then pregnant women. So it's an important cause of missed work, missed school, and there we go. So many people are asking now, there is vaccine fatigue all around. We hear all about it and are encouraged to take so many vaccines. Do I still need a flu shot? And the answer is a very clear yes. So last year we had a record low number of flu cases, which is why a lot of people are asking that. So the reason that we actually did have this record low is because COVID was on everyone's mind and people were generally afraid. So we had masking, social distancing, remote work in school. So now actually most people are back to work, kiddos are back to school, and we've become a little more lax in the world of the vaccine with our masking and our social distancing. So we can't predict how flu season will be this year. So sometimes experts look to Australia and New Zealand where they have a flu season earlier than us to predict. And actually Australia had a very good flu season this year, but it was in part because they also had a good vaccination turnout. So I personally, and we as a country, are hopeful of the same here, that we would like to get the flu vaccine out there, and that's why there are these flu COVID clinics. So flu season will coincide with continued circulation of SARS-CoV-2, which is the virus that causes COVID-19. So reasons to get the flu shot in this setting are that, if you get flu, those symptoms can be confused with COVID symptoms, and they'll all lead to outpatient visits. They'll lead to perhaps hospitalizations if they're severe, and then deaths as well. All of this will stress our already stressed healthcare system. And then we don't know for sure, but we can certainly predict and wonder that when people get co-infection, both infections with flu and COVID, that it might be more severe than if they got one alone. So those are all reasons to worry about flu and COVID together. So the Advisory Committee on Immunization Practices, the ACIP, has given out specific guidelines for vaccination in 2021 and 2022. So I'm going to go through a little of that with you. So first off, people ask, what is the efficacy of the influenza vaccine? So it is a difficult question and it varies. It varies on recipient age and health. It varies on the flu subtypes that are out there. And then it varies on how well we capture the flu subtypes in the flu vaccine that we're giving. So efficacy is a hard question in terms of flu. Who gets the flu vaccine? So anybody who's over 6 months old which is most of us adults and most kiddos actually need to get the flu vaccine. And when do we get it? So we look at a window of the onset of flu in the community, and that's one thing that we really have to look at. And the other thing is we don't want to give the vaccine too early so that the effect of the vaccine wanes, and that can especially happen in older individuals. So right now, recommendations are to give the vaccine by the end of October. So that said, if you miss that time, there's still a reason to get the flu vaccine even after that time. Some communities see peaks in December, some even see peaks in flu for February to March. So the flu vaccine should be given for the entire time that we have flu season, as long as we have non-expired vaccine. So the types of vaccine out there. So we have lots of flu vaccines out there. This year, actually, we only have quadrivalent vaccines. Quadrivalent means that the vaccine works by stimulating a response to 4 different antigens. So what they're doing when they make the flu vaccine, when scientists make the flu vaccine, is they're taking a little bit of the virus called a hemagglutinin and using that to make the vaccine. So they're using 2 types of influenza A, 2 types of influenza B to really capture what's going on in the community and what we saw in years past. We have inactivated influenza vaccines. We're going to have a predicted 5 this year, and then 2 additional ones for older individuals. I'll talk about that in a second. We have a recombinant vaccine, and then we have a live vaccine. The live vaccine is called FluMist, and I'm going to talk a little bit less about that because that's not what's out there and not generally given, and that can affect immunocompromised hosts a lot. So generally, you'll see a little less of the FluMist. What you will see are the ones that are given often, including the inactivated one, Flulavol, which is what we will be giving here in our vaccine clinics. So those are the vaccines out there. Who cannot get a flu vaccine? So if you got a syndrome called Guillain-Barré syndrome, which is weakness in your muscles, and you got that 6 weeks after having or after been given a vaccine, a flu vaccine before, then usually we don't recommend that you get the flu shot unless your risks are so significant that doctors say it's okay, just let's try to give you a different one. So the Guillain-Barré. So if you are allergic to eggs, it is true that in many of these inactivated vaccines, that hemagglutinin, that little piece needs something to grow, and what we use is an egg culture, an embryonated egg. So many of them have it, but there are 2 vaccines out there that don't have it. They're called cell culture. So you can certainly get those types, and you could even get the other types with egg, but with very close monitoring. So there are definitely options for people with egg allergy. We don't, in our flu, I just talked to Dr. Samuel today, and we don't have the cell-free kind yet here at Baptist, but you can certainly get it at Walgreens. Then if you had a prior reaction to a flu vaccine, since there are so many types of flu vaccines out there and so many that I just mentioned, you could still get another one. You would just need close monitoring. So those are the 3 groups that we typically say to stay away from the flu vaccine. That being said, I just want to mention that these are not the same for COVID. So if you had a flu vaccine allergy, an egg allergy, or even Guillain-Barré, it's still okay to go ahead and get a COVID vaccine. Okay, so those are the types of vaccines. And then I mentioned something called a high dose vaccine, and those are only for individuals over 65. And what they do is they really soup up the antigen. They give you more of the antigen, thinking that these older individuals may need that extra to their vaccine. So those are the vaccines. And then now, what are the side effects of flu vaccines? Flu vaccines are actually generally well tolerated. So you might have pain at the site, headaches, joint pain, fever, but they are generally well tolerated. All right, so can we give it with the COVID vaccine, which we will be doing in our flu clinics, in our COVID clinics? So the answer is a definite yes. So we don't, just because we're so new in the process, we don't have evidence to say, okay, we gave flu and COVID together and we found out 6 months later that the efficacy is this and the safety is this. But in the absence of that, we have historical data about vaccines that have been given together. And then we have extensive knowledge about the safety of the COVID vaccine, the safety, the efficacy, the reactogenicity of the COVID vaccine. So it is definitely safe to give along with the flu vaccine. What we do is if you're getting both vaccines the same day, we give it to you in different arms. So in your deltoids and on different sides, and that's what we do. I'm sure everyone's big question is when you give the vaccines together, does that mean you have twice the side effects? And is it twice as horrible? So the truth is we haven't done this enough. We haven't had enough flu clinics kind of around the country to know, are these side effects of getting the two vaccines together additive or not? So we don't know, but like, I can tell you honestly, if I had to do them together, which I might, because it'll be the booster coming out and the flu vaccine, I would go ahead and think it's safe, and I would recommend that because, you know, if you have side effects to flu vaccine and if you have side effects to COVID vaccine, I don't know. For me personally, I think it'd be better to just deal with it all on one day. But you could also opt to do it separately, one on one day and one on another. But again, we don't know if you get them both the same day if the side effects are going to do worse or be worse. And again, flu vaccine is quite well tolerated. So that is what I had about COVID vaccines and flu vaccines. A few other, I guess, tips. People ask, when after COVID can they get the COVID vaccine? So if you've had COVID, then you have to wait for the time of isolation to end, which is usually 10 days after symptom onset if you had a mild disease. And if you had severe disease or you're immunocompromised, it's 20 days after that. So that's when you can get a combined COVID flu shot as well. When you have COVID, even if you have mild COVID, you shouldn't be coming in to get a flu vaccine. First of all, it exposes other people, but it also, if you think you have mild COVID and you get a flu shot and then you get symptoms, it's hard to tease apart then what are these symptoms from the vaccine or from COVID. So we generally don't recommend anyone with COVID to come in for their flu shot. So that is a little bit of what I have, and I am very open to any questions that anyone else has.
Perfect. Thank you. I know I learned a lot from that. We did have some questions that were submitted before, so I'll jump over to a few. So why do some vaccines stop the illness completely while others, like the flu shot, they may not really stop the illness at all?
So the truth is that no vaccine is 100% effective. Not the COVID, not the flu, none of them we have out there, not Shingrix, nothing that we have out there is 100% effective. There are some vaccines that generally do a better job. So actually the COVID vaccines the mRNAs are very efficacious, and they have a different platform called the mRNA platform where they're inserting genetic material. Vaccines like the flu vaccine, they use a little bit of the virus and they grow it. And what they have to do is match it with different strains out there. So those are sometimes a little bit effective, but less effective. But I think the bottom line is when we talk about efficacy, what all these vaccines, the common goal is to prevent people from becoming severely ill. Like even if you get the infection, we don't want you to get severely ill. So the vaccines, the flu and the COVID are generally very good at doing that.
Great. We've seen a lot of questions around, specifically around the COVID-19 vaccine for pregnancy or people who are trying to get pregnant or breastfeeding. Are there any hesitations when it comes to the flu vaccine for those as well?
In August, actually, the CDC openly came out after several other organizations had come out and said, we recommend the COVID vaccine for all pregnant women. So it is very safe in pregnancy. there have been millions of individuals who've gotten the vaccine, and we have a good subset of women that we've studied, and these women did not have increased risk of miscarriages or any adverse outcomes. So it's safe in pregnancy, and in fact recommended in pregnancy. And some of the antibodies can hang out in a woman's umbilical cord area and even protect the baby somewhat. So it's good for, pregnant breastfeeding women. And then same, like there's some misinformation out there that the COVID-19 vaccine can affect fertility, but none of the studies correlate or show that that's happened. So safe for women who are thinking of getting pregnant. So the flu actually is actually different. And for years that we've known that flu makes pregnant women very, very sick. So we've always recommended that pregnant women get a flu vaccine, and that's in any trimester. And if they haven't gotten it in the third, to certainly get it even in the third trimester to prevent the flu. And actually, so since the recommendations for the flu vaccine are anyone over 6 months, that means if mommy gets the vaccine right, close to, then hopefully some of those antibodies will last and protect baby until baby can get the vaccine in 6 months.
Great. We had a question come into the chat. That's, I think, a really good one. She said there's a team member who's told by a physician if she had COVID over 6 months ago, her body has built up antibodies, so she does not need to get the vaccine. She wants to know if this is true or not.
Okay, so that is a myth. And so the reason is because we don't know enough about natural antibodies and natural immunity to say that it will be protective through a certain time period. So for example, if you had mild disease, we don't know how much antibodies or what your antibodies look like when you developed antibodies. So we don't know enough. We actually have that kind of data out of Hutch Cancer Institute, out of NIH funded studies that show that the antibodies that you get from vaccine, they actually do a little bit better in terms of variants and in terms of just protectivity. And so we have that kind of basic science data, and then we have plenty of real world data about the efficacies of these vaccines out there. So right now I'm a part of the exemption team / process. And many people are saying, well, if I already have antibodies and I have some degree of protection, while that's true, exemptions are really, when we think of them, or I think of them as a physician, I think that we grant exemptions when we think that giving a vaccine does more harm than good. But actually giving a vaccine to someone with antibodies, it just adds good to good, because the people who are best off, the people who are most protected in studies are people who have those natural antibodies and who have antibodies from the vaccine. There's actually a word for that called hybrid immunity. And so you are in the best position to be safe and protect yourself if you have both.
Great. Thank you for that. And thank you for asking that question. Please feel free to keep asking your questions in the chat. I have a few more that are a little less specific to the flu vaccine, but still great questions when it comes to the COVID-19 vaccine in general. So a lot of questions around the different variants we're hearing, the MU or Delta. If we get the vaccine, is that going to protect us from those? Do we know? Can you talk a little bit about that?
Sure. So right now in the country, 98% of the variant that we are seeing is Delta. Delta is highly transmissible, and that's why we're seeing so much of it. So in the news now, you might have seen the MU variant come in. So that started in January in Colombia, but now there are cases in South America, in the United States, and in Europe. So that variant is scary because it evades the vaccine a little bit more. And that's why we see it in the news. The World Health Organization has called it a variant of interest because we're looking at it. So all that, though, it's, as far as we know, not as transmissible as Delta, because it hasn't taken off yet. So, Dr. Fauci has said it's not an immediate threat. And that's also the way, I see it. It's because if it were this really transmissible virus and evaded all immunity, all vaccines, right, then it would have just gone and done its thing and caused a rampage, and it hasn't yet. So the mu variant, yes, it's scary. It's scary that it evades the vaccine, we'll probably see more of that. We'll see more variants that kind of try to do their thing to outsmart the vaccine. Right now, what we are most worried about is Delta still in this country. And to add to that, I guess people ask me, what have we seen here at Baptist? So we get, we send batched, batched tests and sampling to the state. We haven't yet seen a mu here, but that doesn't mean that's kind of older data because we send it and we get it back. So that's 3 weeks in. That doesn't mean it won't happen. Florida is actually seeing a lot of these cases, but how much to worry about it is kind of nuanced. I'm still a little more worried about Delta right now.
Right. Yeah, I'm glad you touched on that. That was a question around how do we know, which variant it is. So that's great. Another question in the chat. So you mentioned symptoms and to hold off on flu. What if symptoms are just a normal late summer cough or cold? Should you still get the COVID and or flu vaccine or hold off?
If you think you have symptoms actually right now, I would recommend getting tested because, we are living in it. We are living in COVID in the COVID world, right? So if you feel like there are symptoms just like, oh, I have a cough, I have a cold, especially if you work here at Baptist and you're a healthcare worker, we would actually ask you, not to come in if you have tiny symptoms still, because we don't know what they'll evolve into. So I would suggest if you have symptoms of an upper respiratory tract infection that you get tested. And if you have symptoms and if you're negative for COVID, if you're negative for flu, then you can even wait a few days until your symptoms resolve to come in and to get the vaccines.
Perfect. A question that came through that I really like is, I think we might all have this instance in our life, but do you have any recommendations or personal recommendations on how to encourage others that maybe are afraid to get the COVID-19 or maybe even the flu vaccine?
Yes. So this is all I do. So I try to tell myself these things. So the first thing is to listen to what their individual concerns are, because there are so many myths out there. And I can, start right now and I can tell you safety data, efficacy data. I can tell you address myths about does DNA enter our system, what's in the vaccine, fetal tissue used. I can do all these things, but people are often worried about one or two things. So to try to be empathetic and to hit at or learn what they are most worried about, that would be the first thing. I would say information is great, but perhaps all of this information is overwhelming and coming from different sources. So if you want to direct your friend or loved one to one or two reliable sources, I would say the CDC or the World Health Organization. Just say these, the CDC gives very clear, this is the myth, this is the answer. And that's a really nice way to see things. So just to kind of say, look at one source, it'll give you good data. This is one most doctors really trust, so go to this one. And if you Google something, you'll see, if you wanted to Google why the vaccine is bad, there will be 10,000 articles that show up afterwards. So just to try to direct them to one clear, concise message and not overwhelm them with information. And then the final thing, which I've had to learn too, is that perhaps you're not getting through, you may need a better messenger. So for example, if I'm talking to a certain ethnic group and they for whatever reason they have this worry and I'm not part of that ethnic group, then I may not be the best messenger, that they may need someone who they identify with a little bit more. So those would be what I would say. And then, really, if they have one specific thing, to target the one specific thing.
A few questions about the booster, just sort of a general overview, if you could give one, when it might be approved, why it needs to go through approval. A few questions came through on that.
Okay, sure. I'm happy to explain boosters. So there are two different buckets out there. So two things. So one is if you are someone with a weak immune system. That is, if you are a transplant recipient, if you have HIV, if you're on immunocompromising medications, or if your doctor just thinks for whatever reason you have a weakened immune system, then you are eligible for a third shot right now. You don't need to be waiting. You should go in and get it. And if you got Moderna, if you got 2 of Moderna, you should get third Moderna. If you got 2 Pfizer, you should get the third Pfizer. If you got Johnson & Johnson, we don't know what to do with that group yet. But that is the immunocompromised group. And that's because those individuals in studies, many of them did not develop antibody after getting 2 shots. So this third one is considered as their final to see if they can get that immunity that they need. So I have a feeling when you're asking and when I'm kind of talking about it, we're talking about the rest of the American public, boosters for the rest of the public. So public health officials announced, though the FDA hasn't come out and said it yet, that boosters are coming, that there's a planned rollout September 20th, but we're still waiting to hear. So we're, the scientific community, the medical community, we're waiting to hear. So what we hear so far is that boosters will be recommended for everybody, all Americans, 8 months after they finish the second dose, which would put a lot of us on target right now to be getting the booster. And then that we would still be getting the same vaccine that we got, before. That's what we hear, but we don't know yet all the details about it, and it hasn't been formalized. The plan hasn't been fully formalized. So, for example, things that we're waiting on, there's been some thought that instead of 8 months, that the government and the health officials might actually use 6 months and say 6 months after you got the second vaccine, you can go in and get it. And then there might be a phased rollout, like if you were a healthcare worker or if you're over 65, you may be eligible first, which is kind of what happened the first go around. So we don't know enough about it yet. So Baptist right now is giving the third one to immunocompromised individuals, but not yet to the public at large, to our community yet, just because we're waiting to hear more details about it. And so this is actually not that individuals didn't respond. Actually, the initial vaccines, they did extremely well, and most people developed antibodies, but it's because after 6 months, after 8 months, we don't know what happens to that antibody. And then on top of that, we have Delta right now. So it's really to be proactive for this population.
Awesome. Another question around the booster and specifically when it comes to someone who's maybe already gotten their vaccine and now they're trying to get pregnant. So question around, receiving the booster and making sure. I do just want to say that we do have a talk next week that is going to be specifically around pregnancy and fertility and breastfeeding and the vaccine, as well. We had one last week. But just in case anyone can't join those, would you maybe touch on that as well?
Yes. So actually, that's one of the things we're waiting on the FDA to tell us. But presumably, it's going to be for all Americans. So pregnant women as well will be eligible and will be recommended to have that third booster vaccine. And so if that is what happens, if the FDA recommends it for pregnant women also, which I feel they will, then I would certainly recommend, if you're pregnant, going out and getting the vaccine. I know it seems very scary and then you've already gotten 2, but the whole purpose, the way we're thinking, is that it will give you that much more safety and protection, and your baby that much more safety and protection. And then, what we see in the healthcare world is that when pregnant women get sick with COVID, they are so very sick, and then they need early deliveries. Then that's when you see the poorer outcomes. So certainly, when these boosters are recommended to pregnant women, I would recommend going out and getting one, and then we will have a whole talk next week about safety.
Thank you. Another question. So someone's hearing maybe that the Moderna is more effective or most effective, but they've previously maybe gotten Pfizer. Is there the availability to switch to Moderna if they do get their booster, or is that recommended? Can you talk a little bit about that?
Again, all of these are details that we are even waiting for from the FDA. But right now, what health officials are expecting is that it'll stay the same, that it'll say if you got 2 of Moderna, get one of the the next one should be Moderna, and don't mix and match. What I would say is, these efficacy studies, they are coming out every day about efficacy in the setting of Delta, efficacy of Moderna, efficacy of Pfizer. Right now, both Pfizer and Moderna are both extremely good. So I wouldn't worry that if you got Pfizer, I've seen, the Moderna studies have come out, but I wouldn't worry that you're not protected. People are very protected with both.
Thank you. We're close to wrapping up. One last question that came through. Is there enough research yet to let us know if the COVID vaccine is going to be recommended more than just once, say every year?
So we don't know yet, and that is the $1 million question. There are some doctors who, or some researchers who say that it'll be a 3 and done. So like the hepatitis B vaccine, if you got that, you're 3 and done. But there are many who think that it might be an annual thing. So we don't know yet. There are companies like Novavax just announced that they're doing a combined vaccine, like a COVID and flu together to see, and that's looking like our future also. So we don't know yet. Um, we don't know yet where the ball falls.
Thank you. Well, we are right at 30 minutes. That went by so fast. I know I learned a lot. Thank you, everyone, for joining us today. Thank you, Dr. K, for talking with us about this really important topic. Anyone, if you still need to sign up for the COVID-19 vaccine or the flu vaccine now, please check your email and the exchange. We have lots of opportunities actually starting next week. Here, you can get it at Baptist, or of course, you can look at vaccines.gov to find a location near you. Again, we'll send out this recording after, so if anyone wants to come and watch it again or share with a friend, you're more than welcome to do that. So thanks again, everyone, and thank you, Dr. K.
Bye. Thank you all.
Bye.